Speaker, I come before this House tonight to talk about a very important issue. It's been important for years, and it's going to be increasingly important and increasingly a part of the debate, and that is health care, and particularly health care for our seniors. We've got lots going on. Obamacare, of course, was passed in 2010, and we're running into all sorts of problems. Of course, I and my Republican colleagues here tonight voted against it. Well, no speaker would be complete without a chart, and I have several tonight, and this is one I think it's important for everybody to understand. This pie chart breaks up spending for the federal budget, and if you'll notice, the vast majority of this pie is in what we call permanent, mandatory, or so-called entitlement spending and interest. And what makes up a large part of mandatory spending is Social Security, Medicare, and Medicaid. And the size of this pie, this section of the pie, is growing. In fact, if you recall that back in the 90s, we actually balanced the budget. The last time we balanced it, I think, was in the late 90s. It was a lot easier to do back then because entitlement spending, permanent spending, was not in place to the extent that it is today. It was growing, but not as big. What is the difference between mandatory spending and discretionary spending, which is the other two pieces of this pie? Mandatory means that if you qualify for a certain type of service or payment, whether you're on Medicare, Medicaid, whether you earned it or not, if you qualify for it, the government must pay, and no matter who shows up or how many people show up, the government must pay. So therefore, the government cannot per se control that cost. Discretionary cost, on the other hand, is split into two: defense, which is around $600 to $700 billion a year, and non-defense discretionary, which is what we run government on. That we can adjust, although we've not done a good job in controlling that. In fact, that's increased probably 25% just in the last 2 years under President Obama. But I want to illustrate for you what the problem is, and that is that the entitlement spending, which we don't control, with an aging population and the fact that it's dependent on government spending, is growing at a much faster rate than our revenues and inflation. This is a chart that outlines where we are today with Social Security, Medicaid, and Medicare, the part of entitlement spending. Now let me say, first of all, Social Security is down here in the purple, and you notice that it slants upward and then flattens out. Social Security is not our problem. Let me repeat that. Social Security is not our problem, and people who are on it or will be on it, in my opinion, have nothing to worry about. Now, we may have to tweak it, we may have to adjust it, but you'll notice that the cost really rises relatively slowly, and that's just a matter of demographics. And we can adjust this as we have in the past and make this sustainable. There are other ways to do it in terms of allowing Social Security recipients to invest some of their money and so forth, but that's beyond the scope of discussion tonight. The next group in green is Medicaid and other health care. You notice it's going up faster, and Medicaid is health care for the poor. And then finally in red you see Medicare, and you see how that explodes, and it goes up continuously. Medicare alone will completely displace all the budgetary spending eventually if we don't bring that under control. And that would mean we'd have to give up on government itself, we'd have to give up on a national defense, everything, unless we began to control that. Now, at the rate things are going, Medicare will run out of money, become insolvent by 2020. And that is straight from the CBO, the Congressional Budget Office. Another way to look at it is that our spending is now equal to 15% of the total federal spending is Medicare, blowing out of control. What has made this worse is Obamacare actually cut $500 billion, that is $500 billion, out of Medicare to use for subsidy for middle-class health care plans. So let me repeat, Medicare is running out of money, it's exploding through the roof, and what does Obamacare do, the members who voted for it? It actually cuts money out of it and depletes it of money in the future so that it becomes insolvent. And here's where the cuts are. $135 billion for Medicare Advantage, which is the private health care version of Medicare. $112 billion, which was taken from hospitals, $39.7 billion from home health, $14.6 billion from nursing homes, and $6.8 billion from hospice care. These are very real cuts, and the only explanation that the other side gave us, our Democrat friends, is that somehow we'll cut out fraud, waste, and abuse. Well, let me warn you, anytime a politician tells you he's capable of doing that, watch out, because I've never seen it done, and I don't expect to see it done in the future. Because you see, in order to cut out the massive fraud, waste, and abuse, you have to spend even more money to find all the bad actors. The best way to do away with fraud, waste, and abuse is to make the system much smaller, perhaps even privatize it, and make the system accountable rather than a big government bureaucracy which wastes money, whether we're talking about Department of Defense or Medicare. So that should give you kind of a beginning of where we are with Medicare. Let me just close my opening remarks by saying that there's basically two options when it comes to making Medicare again solvent and available for us in the future. There's a Republican plan which would allow you, if you are currently on Medicare or 10 years from becoming on Medicare, to keep Medicare as it is, and it is sustainable as far as the CBO tells us, indefinitely. However, we would have to reform that for younger adults today who will be senior citizens by opening up the insurance system, creating a marketplace for seniors to buy insurance, and then let government help them with what we call premium support, and allowing competition in private care to drive the cost down and raise the level of service. In fact, that's what we in Congress have today. It's the very same thing. The Democrats, their plan is this: goose egg, no plan whatsoever. Under their plan or non-plan, Medicare runs out of money in 8 years, and they fail to present an idea, much less a bill as we have, that would even solve that.